Can you see my screen, everyone?
Yep, that's good.
Okay, I'll put it in presenter mode here. Hopefully that will work.
And Michelle, you have the deck with just your presentation, right?
I only have mine.
Okay.
Sorry, but so maybe get yours ready just in
Yep, I will.
case. Okay, so welcome everybody to our session, our little breakout session on exploring private research grants. I'm Michelle Baack, and I'm a professor of pediatrics at the University of South Dakota Sanford School of Medicine, and I'm an associate scientist at Sanford Research. And I have both basic and clinical science research platforms. So why are we giving this breakout session? Well, really the objective is to help our early investigators, all the way from trainees, even to established investigators that are exploring new areas of research, a little bit of information to help navigate early career funding or new and innovative funding. And so part of that includes understanding what it takes to have NIH funding and what opportunities lie in there. And then when that doesn't align, or to need to know what kind of stepping stones you need to reach that, we're going to give some information about private grant funding, which is going to be wonderful. So why do early investigators need to have support in order to gain that independence towards an R01 or other mechanisms that will support their lab or their research program for a long period of time? There's multiple reasons, but the four major reasons that you may want to seek private funding or any early investigator kind of grant funding would be to help develop your own independence, you as a scientist, and establish yourself as a credible scientist in order to gain independence, and to help establish a research vision, whether that's one that you're just starting in the research field or that you're starting a new research vision. Second is to demonstrate feasibility of your capabilities. Am I able to actually do this science that will help me answer the questions that I want to with my research goals, and to validate new methods that you may be trying. Third is to help establish a team. So whether that's building an entire research program or a group from scratch, or bringing in key people that will help add to your group, or setting up a collaborative group, that is another reason to start with early career or early investigator grants. And then lastly is really to gain robust preliminary data that's strong, that will help you go in for a very competitive NIH grant. So those are my four main reasons. I'm sure there's many others that you'll hear from the other speakers along the way. So to understand what your goal will be to eventually reach, large grants or NIH, funding, we're going to talk a little bit about the steps of that NIH has for early and career development grants as well. So there are many early trainee grants, fellowship grants, and early career development grants that will help you along this pathway as well. And so that can start even as a trainee. And most of those are fellowship funding grants or training grants at institutions. There's career development awards that actually support you in developing your career in a new location or where you are. And then of course, if you do took out loans for your training, there's a loan repayment plan. There's small grants, which are NIH funded, not private grants, but such as an ROO, or that can lead you to a pathway to independence, but don't take away your early stage investigator status. And so those are kind of listed here. What is an early stage investigator? So for those of you that don't know, an early stage investigator is defined by NIH as someone who's completed their terminal research degree or their postgraduate clinical training, whichever date is later, within 10 years. And so that's important to know whether you are an early stage investigator, and we'll talk about that later. And then what is a new investigator? A new investigator may not be within that 10-year frame. They may be 20 years into their career, but never have had a substantial NIH grant to fund independent work. And that doesn't include smaller grants like ROOs or training grants or other things. So that would be the difference between an early stage investigator and a new investigator. And right here on this, I find this link right here really useful because it talks about different training programs, but the second one too also gives policy about what an early stage investigator is and what a new investigator is. This is probably one of my favorite websites that I found on NIH. You can look as a scientist at any stage in your career for opportunities at NIH based on your level of training. And so this is the website right here. And you can go and you can say, okay, the opportunities for training grants are institutional grants. So let's say now you are an established investigator and you want to start developing a training program within your institution, you can go here. And you can scroll through all the different opportunities for training grants that are available. Also for trainees, what things should you be looking for or applying for or looking at institutions that hold them so that you can apply for those kinds of grants. Fellowship programs actually invest in the individual training programs or an individual fellow, but they are available at undergraduate, graduate, and postdoctoral levels. There's even a senior career fellowship, which I did not know about. I'm kind of excited about this. So if you branch into a new area of science and you're a senior or more established investigator, you can apply for a fellowship again, but in a new career path. And so you can scroll through each of these for those, for training and fellowship, and then for career development plans, your Ks, you can also find that that's where they actually support a candidate in developing their whole career path in an institution to help develop a whole program for a person. Oftentimes that's providing protected time for clinicians or physician scientists or other scientists to help get them started, and mentoring along with some of that. And then there's a research education opportunities. Those are your research education grants, and then the loan repayment program. So if you are in science and you took out loans for your education, you can apply for the loan repayment programs, which will help you get established for your own career. So a little bit about the undergraduate and post-bac opportunities at NIH. There's mostly institutional grants in this area. So the R25, which is your research education programs, which we're mostly familiar with. There's a T34, which is for undergraduate NRSA award to enhance diversity. And then there's both a T90 and an R90, which are for an established PI to mentor someone in their lab. So if you're a lab that's looking to sponsor or train someone, the T90 is for sponsoring someone in the US, and the R90 is for sponsoring someone who's a non-US trainee. So that's to help increase diversity and more underrepresented in science funded scientists. And then for graduate and clinical doctorate levels, that's really mostly there's some institutional awards, such as the D43, which is actually international training grants. So if you have someone from a lower middle income country and you would like to sponsor their training, that is a D43. There's a T15, which is continuing education based upon past work. And then a T32, which many of us are familiar with, is for pre and postdocs in shortage areas. And then a T35 is a short-term grant. And then the T90 to R90 mechanism actually is an interdisciplinary grant. And then there's individual awards at the graduate and clinical doctorate level for early independence, the DP5, which actually I'm not familiar with this mechanism. So if someone's received this, I'd really like to hear about it, but it's to allow a postdoc or allow someone to bypass their postdoctoral period towards independence. So it's for highly skilled, I guess, early stage or early independence awards. And then the F05 is international fellowship programs. The F30 is for MD, PhD fellowships, and those are mentored fellowships. And then the F31 is the PhD mechanism. And then there is an F31 diversity, which is specific for F31s, but it also is for underrepresented in science. And then there's that F33 senior fellowships in a new direction, which I didn't know about, so I'm passing it along to you in case you are in that category too. And then there's the F30, which is NIH bound. So those are for people who actually want to work at NIH. And then the F99 to K00 transition is really going from a fellowship directly to your own independence, and it funds you in steps. So it funds both of those portions of your career. And this was another new one that I was not familiar with, but there's an R36 mechanism that is a dissertation award. So it's different than a fellowship award in that it actually funds both some of the science, like the direct costs of the science, plus some of the stipend for a PhD or MD PhD student, and that's doing a dissertation. But they are in set categories. There are a lot in neuroscience. And so I passed that along to some of our group at Sanford Research because we have a lot of neuroscience there and a lot in addiction special medicine. And they're special, programs for a dissertation award different than an F30 or F31. Postdoctorate and early career development grants are robust at NIH, and I'm sure many of you are familiar with these. Of course, there's the NRSA the F32 that we talked about, and the DP2 Directors and New Innovator Award. All of your K mechanisms are your career development awards, where they support a mentored training and scientific career program development at your institution. And then some of them are for physicians or clinician scientists, early to mid-careers. There's a career transition one, which is a mentored two-step one, that like the K22. And then there's patient-oriented, quantitative research. And then there's two for global or emerging global leaders, which are really doing global biomedical research or international research. And then, of course, we've talked about the K99 to R00 and then the loan repayment. You can find this really great tutorial at this YouTube website that kind of walks you through different nuances of each of these two. So why are these things important? Because there's a next generation research initiative that was established by NIH to help support early stage investigators and new investigators. And like we talked about, those early stage investigators are those that are within 10 years of their terminal degree, and new investigators are those that have never received an NIH large award. And what that does is it prioritizes meritorious ESI scores for funding for R01 or equivalents. So you get a little bump, so to speak, not in your score, although there's a little bit of difference in how they're reviewed at some study sections, but it would, your funding level or your pay rate may be different if you're an ESI or a new investigator at different institutions. And so developing yourself as an early stage investigator with private grant funding and getting you in that competitive range will be very, very useful if you can do that. And so that's why this is leading up to that. What are the R01 equivalents that actually an ESI score would help you out? It would be all of those mechanisms listed here. Smaller grants like the R00 actually do not take away your ESI status. But if you're a multi-PI, like a COI or in another person's R01, it will take away your ESI status. So you should know that if you've never had your own independent R01, that if you're a multi-PI, that would count against or count towards your away from your ESI status. Small business awards do not take away your ESI status. And of course, not take away your new investigator status, even if you're out of that 10-year window. So how do you make sure that you're at ESI? If you are an ESI, how do you make sure in ERA Commons that you are an ESI and that's marked, or what do you have to do to apply? Really nothing. If your terminal degree date is within 10 years and it's listed on your ERA Commons as such, you should have a denotation in your ERA Commons that says ESI, and it will give you the date at which that expires. So when you're going in with funding, after that 10-year mark, you will no longer be considered an ESI. Otherwise, it's automatic. And the scientific review officer will automatically, or your program officer, put you into those categories. One thing that you should know is that for ESI, let's say you're right on that 10-year window, and because it often takes 10 years to develop enough science that's robust on your own to become independent. But if you're right on that borderline, if you submit, but then you resubmit after you make some revisions, the first submission date is the date which would be considered for ESI status. Also, there's ways to extend your ESI status. If you take maternity leave or have a medical condition or family care responsibilities, COVID counted as a national disaster, and then active duty military, you can actually apply to the ESI Extensions Committee to extend your ESI status date. And that may help some of you that are in that time frame of 10 years postdoctoral. So how do you then understand what is NIH funding? What do I have to do as an early stage investigator to get NIH funding? And which institutional center do I align with? How do I find a PO or a study section member? Using Reporter is a good way to do that. And you can actually do quick searches to find what they're funding by state, what institute or center you should be applying to. And then you can use this wonderful tool called Matchmaker. And I'm only telling you this, just many of you may know this, but you can, and on the next page I'll show you, you can actually type in your abstract and your title or your specific aims page, just enter it in here, and it will match you with what institution the AI will assign it to, usually, honestly. And a program officer, and your review panels. So this is a really helpful tool. And if you're new and you want to play with this, you can see, okay, is someone else already doing this science? What is the level of science that they're doing? And what do I need to gain as an independent new person coming into the field to compete with that? Because it's very difficult to get, 10 to 20% of that funding. And so you'll apply a lot. And so putting it into Matchmaker, you can kind of see what it would take to get towards that big R01 or independent funding. And I'm telling you this because you may need more time and more money, more independence, more validated techniques, more preliminary data than you know to actually find your right match. And I don't think it's unreasonable to think that it may take you that full 10 years after your terminal degree in order to get your first R01 or other. That's very common. And so this is where private funding comes into play. And so where do I look for the money and the resources and the tools to help me build that work that I need to do to get to my independence through independent NIH funding? There are many opportunities. And so when we were told to talk about private research grants, you could talk about hundreds and thousands of individual grants. And so first and foremost, I'm going to talk about how we did it, how I kind of navigated it, but you can look at three major places: local opportunities at your own institution, your academic affiliate, your any foundation that's associated with your institution, and then within your community. You can look at organizational opportunities. So if you're affiliated with a set scientific program or society, they often will post grant opportunities. So for me, American Heart Association is one, and so they have training, they have grants for all early investigators, postdoctoral fellows, early and established grants, and they have regional and national. So does American Diabetes Association. And then industry sponsored or mission based, like where is your research? What's the mission of your research? And what other organizations have that same mission? And aligning it with your goals, but for your scientific goals, with the goals of the funding agencies is key to getting private funding to gain preliminary data and independence. And so these were just some that aligned with my work that we'll kind of talk about, but there's many, many more. Dr. Rezvani is going to talk a lot more about some, but I also found this really nice website here. It's non-NIH funding, and honestly, there were 75 pages with about 20 different grants on every page. So there's hundreds to thousands of opportunities that you can find if you just find what aligns with your mission. I'm gonna, maybe to help make this more practical, I'm gonna walk you through how I did it, just because I think it kind of helps you understand that you don't just come out and you think, my science is so cool, I love my science, everyone will love my science, and NIH will love my science, and they'll just give me money because it's fun. Not gonna happen. And so how do you get to that point? And so for me, I'm gonna give you tips. You will apply broadly to everywhere that is in line with your mission. You should apply often, and you should think ahead to get the tools and the amount of resources that you need to build your dream for 20 to 30 years down the road. And sometimes that's often hard to see, but that's kind of the way that I think you need to think about it. So for me, I actually had a very circuitous professional path. And so I graduated from pharmacy school way back in the dark ages, went to medical school, went to residency, went and worked as a general pediatrician for 10 years before I ever decided to go back to be a fellow in neonatology when I was 40. So I am a senior person that started their career over, but there I fell in love with research and had no idea and had never had really a lot of research or opportunities ever in my career. And so during my fellowship, I actually had wonderful mentorship, and I applied for a Children's Miracle Network Foundation grant because it aligned with my mission. I was able to apply for a T32 project, and that funded my training. And then as I transitioned, I knew when I came to Sanford Research that I wanted to build both basic science and clinical and translational science kind of programs or platforms, because I'm a physician scientist. And so how do you navigate that? Well, I was fortunate for my clinical research that I did receive, a small institutional award, a foundation award from Sanford Research Foundation, and some startup money. And then I received a Gerber pediatric nutrition grant. And then after that, I was able to get my K08, but I had to take multiple foundation grants and institutional infrastructure funding to build up enough preliminary data to submit to get this next step, which is my career development award, which is the K08. Then now subsequently, we have some established clinical pediatric research in the NICU. And so we became part of the Neonatal Research Network, and we now have run 15 studies in our NICU, which has, now developed the clinical infrastructure that we needed to do neonatal research at Sanford Research. For my basic lab, I also applied broadly and many, many times, and often many times rejected. I didn't even put the ones I was rejected on, but I had multiple foundation grants, both from Sanford and from USD. Then my K08 career development plan, more foundation grants to get preliminary data, finally a COBRA project leadership, which is equivalent to an R01, but it's under a program. And then I finally was able to get my R01, but I will tell you, I submitted an R01 application every cycle for 2 years and got in just at the end of my ESI status. What, an ESI status when you're in your 50s? Yes, because remember, your ESI status counts at the 10 years after your final research training. So my ESI status actually did go with my terminal degree as an MD, and I actually applied for the extension and was able to say that I didn't start research until 2011 was the end of my research training. And so I actually did apply for that extension and was granted it pretty easily. And so I was able to count as an ESI status, and that is the way that I was able to get my R01. And I'm still applying for foundation grants. We have a Burroughs Welcome Grant. So I hope that kind of explains why private research funding is very important. So how do you get or find private research funding opportunities that align with your goals? I'm going to turn it over to Khosrow, and he's going to give you his practical advice on how he did that. I suppose, okay. Khosrow, I have to stop sharing here just a minute.
Yes, please. Yes.
My screen, of course, went away. Okay.
Okay. Okay, everybody can see?
Yes.
Okay. All right. First, I would like to thank DaCCoTA for organizing this seminar, and also particularly thanks Dr. Michel Baack for giving the extended, detailed review of the availability and why we need to start thinking about applying for this type of private grant at the beginning, at the early stage of the career. So, Michelle, you made my work much easier to continue. So, I am a faculty, a researcher faculty in Division of Basic Biomedical Science at UST. My background is molecular biology, and what I'm going to share with you here is more a personal experience that I had with this private agency when I started my career as an independent faculty at UST. And this is something that I had to go through the several learning process, because my initial background when I completed my postdoc was in the neuroscience field. However, when I joined UST, because of the team that they planning and the ultimate goal of the division, I tried to move to the cancer field. It wasn't a easy transition, and of course there were a lot of resistance, and as a result this type of private and more smaller funding agency was really a helpful and essential support for me to generate the preliminary data that needed to go then for the federal grant. So all right. So as I said that one of the things that I found from this small agency and a funding agency, that you really need to do a good homework and understand their goal and mechanisms. Because if you don't know, then the rate of success goes down. So at the beginning, I thought that I can reformat my grant and send for different society. But later I found that I really, per agency, I need to do a good homework. They understand their ultimate goal, the topic, scope, and the budget. And then I basically formatted toward type of this society. It's, as Michelle said, that it's very important this agency particularly prefer to support the early career to the mid career. But very clearly, many of these funding agency highlight and give the basically conditions that they prefer to support an early career and not a mid career, and vice versa. And one thing that I really find important, that when you find a funding agency, try to definitely register for the email alert, because sometimes these agencies, they have different timeline for the funding. Sometimes it's in the fall, sometimes they change it to the spring. So to be ready and not to miss the due date, it's very important to, whenever you find a funding agency that is not, doesn't have any open submission for now, it's important you know in advance. And so I really find very essential that to have in their email alert, and this is help. So as I told you that I transition from neuroscience to cancer. And that's why at the beginning, I really found out talking with the colleague at that time until now, with my colleague and collaborator in Stanford, it's really helped me to learn about some of this agency and how to apply. Even some of my colleagues in Stanford, they are enough kind that share their entire successful grant with me, to helping me to better design my proposal. So it's very important to talk with the colleagues that they do in the similar project. I also found that sometimes looking at the acknowledgement of the articles that they acknowledge funding sources, it's very important. To be honest with you, for example, I started in the last 2 years to work on the obesity and cancer, and I found some agency through this acknowledge. Face-to-face talking with society and companies that they have booths in the national conferences, especially, sometimes is helpful. I got the opportunity to work with a company that they are interested to work on the sodium receptor, and my small molecule that I'm working as an anti-cancer apparently also binds to the sodium receptor. So they were willing to help me for a small money to, while I checking their antibody, also I was able to do some of my research in this regard. Many of these funding agencies, they have a list of the previous winner, and even they provided abstracts. So I strongly suggest that look at the previous funded scientists in that particular society and see how they design, how they directed their project. I found that especially in the small university, it's important to have still publications. Even a small review, it helps, because still you need to compete with people that submitted to this funding agency from bigger university or cancer centers. So it took for me at least another year after joining the USD to be able to be basically recognized by this agency because of the publication. Definitely collaboration with another scientist. In this case, I use my colleagues in Stanford that can add it and bring it another technology to the work. It really helped for getting their attention. I also found that some of this agency is very important for them to have a released letter from the dean. It's something that I was told that it's good to have in your application, so I just put it as a helpful tips. Definitely, another thing that you need to really be realistic about the timeline. They have a small money for a small time, 1 year. So you need to have a very clear timeline, and please do not to be over ambition, because then they will say that you need to try for the federal grant. This is not the direction. So as a general, you really need to do a good homework. Michelle shared with you many useful link and search machine in NIH, and some video that available in YouTube to find and navigate between these search machine. I know it will take time, but it's worth it, because sometimes you can locate a good agency that completely related to your work. When I 10 years ago, I looking for this type of agency because I was working on the colorectal cancer. I simply use the common searching machine and then some special software to look for. But honestly, recent days, they are much easier. The several software in a different way, they look at the available funding. I put example here, a candid search machine. And interestingly, when I put the colon cancer, one of the two high best option for me that it suggested it was fight colorectal cancer and colorectal cancer aliens. I tried both of them at the beginning of my career, but I really found that they developed and improved this searching machine much efficient to find your target. So here I just briefly give some examples to highlight that if you do your homework very good, you can find many sources that you need to apply. As Michelle said, that you need to frequently apply for the different sources to finally have a successful funding. Is really needed to try several of them because a level of competition, the rate of success is low. It just, you need to increase the submission. Here, American Cancer Society is one of the sources with the different opportunities. Some of them, like Treasure Research Fund, focus on a special population, like, for example, in this case, pediatric. And again, they highlighted that they prefer early career award. Susan Komen is another one. The AACR is, if working in the cancer area, it's one of the other that they have very useful email alert system for the funding opportunity. And I just, during last 10 years, maybe every 2 years, I had a completely a funding opportunity related to my work, and I apply for that. So I strongly recommend that, and definitely for your area, you have some of these. I know that in the neuroscience field, we have the Alzheimer, Parkinson, for the Crohn colitis. Obesity is something that I told you that it's is another that I started to work on this area. And what I did with this obesity society, as Michelle said about the earlier career, so I contacted them and I said that my project basically now is kind of changed to the obesity. Is it something that you still can consider me as a new approach, an early career? And they said that, yes, share with us the abstract and we will look at that one. And they show interest, despite that I am a mid-career / senior position at USD now. The melanoma is another one, and I'm sure you heard about the DoD type of grants. Every year they release a specific type of funding for the different type of cancer, for the ovarian, breast cancer. They had 2 years ago for colorectal cancer, but last few years, they also have this IDEA award that is for the different type of cancer, and is the letter of intent is in May. So May 2024 would be the first one you can apply. And I found that, honestly, I called and recommended by my mentor at UNMC that it's definitely is a good alternative for the NCI that is these days is very difficult. And another good thing about the DoD is just they also give money for the cancer, for the university that they do not have the cancer center, so is slightly a better chance. So I finish with this again, and again you need to do a homework to find your target. We frequently submitted the grant, and if you have any question regarding to this type of software, I have more of these search machine that definitely I will be happy to share with you later. And now I give to Dr. Weimer to continue the talk about the other opportunity for the funding.
Excellent. 1 second. I can get my presentation up. And I did mention I'm going to turn my video off while I'm presenting because the Wi-Fi where I am is a little dodgy. Michelle, can you just let me know if you can see my slides?
Yes.
Yes, we can.
Okay, and I would ask too, if I break up, why don't one of the two of you just flap your arms at me?
Okay.
That way I know to start back over. If I get this out of the way, I'll get it in presentation mode.
You're a little bit hard to hear, Jill, so maybe get closer to your mic, but otherwise it looks good.
I actually have a headset on with a mic in it, and as I talk, this is really weird. This mic will get progressively louder, so hopefully we'll be fine as we go along.
Okay.
Is that okay?
Yep. Mm-hmm.
Okay, so like Khosrow and Michelle, I just want to start by introducing myself. My name is Jill Weimer. I work at Stanford Research. I've been there for 14 years. From an administrative perspective, I help oversee the translational and therapeutic sciences, working in concert with our executive director for basic biomedical sciences. And I work in our pediatrics and rare diseases group. I have an academic appointment at the University of South Dakota, but I also serve in this unique dual role where I straddle academia and private industry and serve as the CSO of a Philly-based therapeutic company, really tied to a transition in some of the drugs that we developed in our academic lab that moved into the clinic, and then were handed over to the pharmaceutical company. So in terms of what I'm going to talk today is kind of like rounding out the conversation from training, foundation, and just talking about, oh, and I didn't change Michelle's title. I hijacked Michelle's slides because they look so great, but I transitioned the learning objective just slightly into what I'm going to talk about, and looking for funding opportunities that really bridge the partnership gap, and mostly focusing on partnerships that I live in between academia and industry, and how you start to build those relationships as a funding stream and funding relationship. And how really what I want to focus on is actually how you develop those relationships so that you can. Because I think this is very unique compared to academic grants with NIH, and a slightly different, takes a little bit more maybe homework up front in how you foster this. I think just like Khosrow and Michelle said, persistence is extremely important, but here collaborations and relationships become absolutely vital. So if you want to go down this path, say you have a technology or a drug, or even like in the case the examples that Khosrow gave, maybe you work in the cancer research space and you're interested in doing some screening and you want access to or resources from industry to help get access to drugs that you would screen. Really, you need to start establishing those relationships long before you would look for money. So you want to look for a good synergy. So what is your team able to bring to the table, but also what is the industry? I think sometimes people view industry and academia relationship as a take-take relationship, but it really needs to give and take. You need to get something out of the relationship. They need to be able to get something out of it, but you also should bring your expertise, your know-how, and your scientific merit to the table. Recognize that the way that industry and pharma operates is very different than an academic lab. And I have learned this time and time again. They speak a completely different language. If anybody's ever worked with a clinical research group and you're a basic scientist, they speak a different language. It's holy heck, getting into working with a CMC team or a regulatory team. They have acronyms and vernacular that I've never heard before. So just understand that how they operate and what their end goals from a project are going to be completely different than yours. So just be transparent going into it about what you want to get out of it and what they want to get out of it, so that you're jointly together and walking through this process. One of the things that for me has been the absolute most vital and imperative part of working successfully in either large teams or with an industry partner is that you have to have a project management mentality in how you do your work. That's something that in a traditional research lab, academic lab, we don't apply. This means mapping out timelines, setting objectives to the research that you're doing together, have deliverables. All of these things need to be pre-defined and mapped out together, and take it to a very, very high level. I think NIH now is doing an okay job of mapping out strategies for document management and rigor and reproducibility. But if any of you guys, it's Khosrow, and if you work in the neuroscience space, you guys will know that over 13 or 14 years ago, Storylandis put out an article through NINDS that mapped out that one of the #1 reasons that industry and pharma folks did not want to work with academia is because time and time again, they had taken programs that had been developed internally in academia and pulled them into a pharma company and tried to carry a drug development project forward. And something like 80% of those failed because the academic partner lacked the rigor and reproducibility to take a drug forward in development. So the NINDS actually implemented a process for rigor and reproducibility. That's now the program that was rolled out about 4 or 5 years ago to the rest of NIH. But it's something that industry partners are still, they feel that sting because they've lost many millions of dollars on these relationships. But continue to foster the relationship with the industry partner so that you can actually plan your ask. The next thing you need to do is identify and develop those industry partnerships. So with an NIH grant or an SF grant, the ask is really going to depend on the number of this stage of the project. Is it brand new and you need seed money to start developing the study? Is it something you've been working on for years and you're looking to take it to the next step? So sometimes you could look to maybe a foundation partner to give you the seed money to kick it off, even with the industry partnership. Maybe they're supplying the drug, but what you're really trying to do is get that initial proof of concept data. Or are you looking for something that's going to fund IND enabling studies to actually launch a clinical trial? What are the resources you need? Are they financial? If they are, how much financially do you need? Do you need people resources? Do you need access to technology, drugs? Really have that planned out on what it is that you actually need the industry partner to bring to the table. And again, like I said before, make sure that you're both bringing something valuable to the table. Don't let them just really view you as a CRO, who's doing contract work for them. Let your expertise shine through. This one is really hard to sometimes swallow as an academic scientist, but it's really important that you bring your institute's teams together early on before you initiate these industry conversations to make sure that you have all your ducks in a row. And I mean this from the perspective of making sure to include your business development and your legal folks very early on, because you don't want to give away the baby with the bathwater, right? Like you don't want to have a brilliant idea that could have been like the next like cancer treatment, have a conversation with a pharma company, and all of a sudden like your IP is gone because you didn't have it protected. So make sure that you're letting them be involved in these conversations early on. And I think that this is just really different than traditional academic funding, where when you apply to the grant, it applies to the NIH, your IP is actually protected. And there's a confidentiality agreement that all reviewers must sign that they're not going to take that idea. So make sure you're starting with a CDA or an NDA, that you have MTAs in place for any technology or materials you're transferring, that you have a research collaboration agreement, and everything is mapped out. So that then you have sort of this cadence of regular meetings to be able to push the collaboration and transparency forward. So then once you've got all of that established and sort of the groundwork is laid, then it start to think about what would be a good match for funding. I will push you back to the matchmaking Matchmaker that Michelle made at NIH, you can actually still even put information into Matchmaker, and it will help you identify, say, an SBIR or STTR that would be appropriate for funding. SBIR, small business grants, have an industry and academic partner. They come in a couple of different phases depending on where you are in the project development, but they do have the limitation that the partner has to be a small business. So they have a headcount cap on how many employees the pharma or industry partner can have. NSF has the partnership to accelerated technologies. If you're going that route, NINDS and the neurosciences actually have a lot of phenomenal programs if you're in that space for drug development, including the Ignite grant, which is essentially an R21, R00 platform for drug development that then springboard into these blueprint awards for development of drugs in the neuroscience space, and they can all involve industry partners. They can even be initiated by an industry partner and bringing in an academic collaborator. You can also look for direct industry funding. This is, one of the ways that my lab has really kind of bridged that partnership with the pharmaceutical company that I work with. We do a lot of their in vivo pharmacology work, drawing on our expertise in lysosomal storage disorders. So really our team is still bringing our expertise, know-how, and knowledge to the table, but that gives us access to grant funding direct from the pharmaceutical company. A lot of pharmaceutical companies also have industry grants that you can actually find on their website. Sometimes these are simply to give you access to a drug that you want to screen or test, and you can put those requests in direct. But sometimes they do also fund research, either collaborative projects through their discovery division, or their medical affairs department will often also do physician or research investigator initiated awards that really are not necessarily collaborative. They're for your lab. And then there are also opportunities for contract work if you want to go that direction. And then, as I mentioned, just on the perspective of building on Khosrow's, like there's a lot of foundations too that will help either serve as direct matchmakers. So I did a lot of work with the Children's Tumor Foundation. They frequently are setting up meetings for me to talk to big pharma about drugs they have that might be beneficial for neurofibromatosis type 1. So how do we actually bring those together? So even small foundations oftentimes will provide seed money to help you kick off and initiate some of these grants. So I'm actually going to stop there. I'll stop sharing. I did want to just make sure that we leave a few minutes for questions and comments, but I do also want to just add to a few things that Michelle and Khosrow said. One of the things when you're looking at either training grants or early stage investigator grants and a new investigator award, make sure that you look at your institute, because every institute actually has different rules and criteria. So just as an example, NINDS started a policy a couple years ago where if you're a postdoc and you're applying for an F32, you have to do it within your first year. After that, you transition to a K award. All the other institutes have still kept F32s as far as I know for postdocs, but just make sure you know the nuances of your specific award or your specific institute you're applying for. And some of that, as Khosrow mentioned, comes from signing up for those emails. But one of the most valuable things you can do very early in your career, and I know that your mentors tell you this 100 times, but it is extremely valuable for you to form a relationship with your program officer. And it may not end up being your program officer, but just knowing the ins and outs, the know-how, and getting your foot in the door. One of the things that will improve your grants exponentially more than anything else you can do is serving on study sections. You get to see what works, what doesn't work. So if you can get your foot in the door with a program officer, they can recommend you for study sections that then will help improve your grant writing, just little tricks of the trade that are really going to help set you apart, little nuances you're going to pick up in grants. But be, like Michelle and Khosrow both said, be persistent, try many different options, don't give up, keep your head down, and don't assume that one size fits all. Like Khosrow said, you can't just take the same grant and repurpose it for 20 different funding sources. They need to be tailored for those. But at the same time, you know your science, and you can read those comments and you can pick up on what is something that they're willing to work with, but also don't be afraid to throw in the towel and pivot to something different. I think the one that is like the persistent problem is when somebody for multiple years just keeps sending in the same grant with minor tweaks. And study sections see that and they get frustrated when they see the same thing over and over and over again. So know when to pivot, know how to read and interpret those comments. So I'm going to stop there. I know we're almost up against time, but I just wanted to open it up if there are any questions or comments. And Michelle and Khosrow and I am also, I'm sure, speaking on their behalf, will be absolutely happy to answer too if you guys have questions.
I don't see any questions in the chat. But please, like Jill said, please feel free to just email any one of us and we can help answer anything that you have or get you to the right person that can answer that.
Thank you, guys.
Thank you.